Well, we know many questions about coronavirus are swirling, including how it spreads and the response here in New Hampshire.
So we've asked New Hampshire State epidemiologist Dr. Benjamin Chan to join us to help answer some questions sent in by WMUR Facebook viewers today. Thank you so much for joining us today.
My pleasure. Thank you.
The first question is, if you need to be or find yourself in one of the states that has one of these clusters, say in Massachusetts or New York, what should you do?
Yeah, so that's a great question. I think it gets at the question of travel, right? And we've seen this virus in a relatively short period of time, over the course of two and a half months, spread from the epicenter, which was within China, to most countries throughout the world, including the United States. And now we're seeing increasing numbers of cases within the United States. I think what's important to recognize is that this is a rapidly changing situation. And so the Centers for Disease Control and Prevention has travel-related guidance that they have put on their website, both for international travel and also guidance for people that may be traveling domestically. And so my first comment would be to point people to that website as a resource. But it is important to recognize that there are parts of the United States that are having increasing numbers of cases and evidence of more widespread community transmission. And so there's locations in the state of Washington, for example, in California and New York, where they're seeing more sustained community transmission. So it's important for people to pay attention to what's going on, understand the situation globally and nationally, and review that information on the website to be able to make an informed decision about where they're traveling and what the risks might be. But I think it comes down to we expect this virus to continue to spread based on what we've seen globally. And so no matter what people are doing, whether they're out in public or traveling, they need to take precautions to protect themselves and other people. And we can certainly get more into that, which I'm sure we will, but the same recommendations that we repeat every year during flu season.
And speaking of taking precautions, do we have guidelines right now for maybe someone who's taking care of someone showing the symptoms of COVID-19?
Yeah, so the difficult part here is that the symptoms of COVID-19 can resemble many respiratory infections that are circulating this time of year, whether that's influenza, there are other viruses like RSV, parainfluenza. There's a whole range of different viruses that can cause the symptoms of COVID-19. Those symptoms oftentimes are fever, cough, maybe difficulty breathing, less commonly upper respiratory symptoms. But it's important for people to take precautions no matter what virus it might be causing this. And so if someone is taking care of someone with these symptoms, we encourage them to practice good frequent hand hygiene, make sure people are covering their coughs or sneezes. If the person that's symptomatic can wear a face mask, a surgical face mask, to help with what we call source control, so to prevent spread of respiratory droplets.
The patient would wear that?
Correct. The patient would wear that. And that's important if somebody walks into a doctor's office or there's home health visiting someone. One of the ways that the sick individual can help prevent spreading is not only covering coughs and sneezes, but if they're going into a doctor's office or having a healthcare professional evaluate them, putting a surgical mask on. That's for sick people.
Dr. Chan, we've got less than a minute real quick. Sandy asks, if a person felt they had the coronavirus recently but had now recovered from it, would a test now confirm they actually had previously had it?
So the tests that we currently have to diagnose coronavirus are nose and throat swabs that detect the actual genetic material of the virus itself. To tell if someone has had it in the past, you need an antibody-based test. Antibodies look for the body's response to the virus. Those are currently in development by the CDC and other agencies.
All right, thanks, Dr. Chan. We have more of your questions coming up. We'll be right back.